This means that only 9 passengers are allowed in a passenger bus. Remember, stay safe, travel wisely as we work together to flatten the curve.
Before touching the mask, clean hands with an alcohol-based hand rub or soap and water. Take the mask and inspect it for tears or holes. Orient which side is the top side, where the metal strip is. Ensure the proper side of the mask faces outwards, the colored side. Place the mask to your face. Pinch the metal strip or stiff edge of the mask so it molds to the shape of your nose. Pull down the mask's bottom so it covers your mouth and your chin. After use, take off the mask. Remove the elastic loops from behind the ears while keeping the mask away from your face and clothes. To avoid touching potentially contaminated surfaces of the mask, discard the mask in a closed bin immediately after use.
Symptoms of the coronavirus are similar to those of the common flu or cold, which are consistent coughing and sneezing, fever that does not go away, and difficulty breathing. If you are experiencing any of these symptoms, it is advisable to stay at home until you recover, or if you want to go to your doctor, call first and tell your doctor of your symptoms, any recent travel or contact with travelers. And lastly, please avoid spitting in public. Recent cases have shown that people most likely to be at risk if they contract the virus are persons over age 60 and persons that have an underlying medical condition such as hypertension.
Is on.
COVID-19 weekly briefing for today, the 19th day of January in the year 2022. Thank you so much for joining us for our briefing. We continue to appreciate you as you continue to follow these briefings and to pay attention to what is happening in the Federation of St. Kitts and Nevis in relation to how we are managing the COVID-19 pandemic. Your part is extremely important in the management of this COVID-19 pandemic. So thank you again for being with us. Today I want to invite first to the podium our Chief Medical Officer, Dr. Hazel Laws, who, as usual, will present us with the Health Emergency Operations Committee Situation Report.
Mr. Williams, and good afternoon to everyone. All right, so this afternoon, it's my job as per usual to share with you the HEOC situation report for this afternoon, Wednesday, January 19th. We have been responding to the COVID-19 pandemic since January of 2020. So we are approaching our third year in this pandemic response mode. The COVID-19 pandemic has not only affected our health system, it has affected our economy, our social life as we know it, and even the sporting fraternity. Our vaccination program, we are very proud of our COVID-19 vaccination program. We've been rolling out the administration of COVID-19 vaccines for almost 1 year. We started in February of 21. Now, I want to commend the 25,907 individuals who are fully vaccinated. They have provided themselves and the Federation on a whole that immunity that is providing that level of protection even as we work our way through this fourth wave. And so over this past 11 months, I will share with you the vaccination coverage rates that we have achieved. 81.9% of the adults in our population have come forward and received the first dose of the COVID-19 vaccine. 76.2% of the adults in our population are fully vaccinated. And in terms of the 12 to 17-year-old, the teenagers, they started receiving the Pfizer-BioNTech vaccine around September of last year. And so far, 17.5% of the teenagers have received the first dose and 14.9% are fully vaccinated. Now, in terms of the booster shots, adults have been coming forward to receive their booster doses. 7.8% of the adults in our population are boosted. Now, I just want to provide you some additional information regarding the COVID-19 booster. Booster shots are available to individuals who have received the 2 doses of the primary series of their COVID-19 vaccine. Now, if you receive the second dose of your primary series 5 months ago or beyond, you are free to come into any health center and request the COVID-19 booster shot or the Pfizer-BioNTech booster shot. This slide shows the data disaggregated by island, and it tells you that in terms of the percentage of adults fully vaccinated, 79.8% of adults in kits are fully vaccinated, and 66.9% of the adults in Nevis are fully vaccinated. And by extension, the teenagers in Nevis, 12.2% are fully vaccinated versus 15.7% in St. Kitts. And when we look at the entire population, 54.9% of the total population is fully vaccinated. This is good, but we still have work to do in terms of bringing the rest of the adults and teenagers in our population on board. Now, the SARS-CoV-2 variant in circulation. Now, we've been sending off samples to the Caribbean Public Health Agency for genomic sequencing, and you are aware that the Lambda variant has been in circulation since May of last year, 2021. Now, the last batch of samples were sent off on January the 5th, and all 25 samples, the results returned positive for the Omicron variant, which is a variant of concern. And so this provides us objective evidence that the Omicron variant is in circulation and probably is now the dominant variant in circulation in the Federation currently. The COVID-19 situation, and so to date, well, let me just back up. We have been in this fourth wave since about Christmas Eve. That's the 24th of December, 2021 to present. And we continue to enjoy an excellent recovery rate. And so an increasing number of our positive cases have recovered. So to date, 3,923 cases have fully recovered, with 624 on the island of Nevis, 3,299 on the island of St. Kitts. And so at present, we are following or monitoring 1,114 active cases, with 123 cases in Nevis, 991 active cases on the island of St. Kitts. So to date, we have reported a total of 5,065 confirmed cases of COVID-19, and our COVID-19 related death count remains at 28. It has been at this number for a couple of months, and we hope to keep it like that. Now, this slide shows the fourth wave that, as I said, we've been going through since Christmas Eve to present. You realize that the number of newly diagnosed cases each day, the numbers are going down, they are going in the right direction, and the number of recoveries, daily recoveries, is increasing. And round about the 13th of January, you realize that the number of recoveries seem to be exceeding the number of newly diagnosed cases daily. And so that's a good thing, and we hope to continue in like manner. This just provides us the raw numbers in terms of the number of recovered cases. So yesterday, we reported 114 cases recovered, and you could see the pattern on the January the 17th, 86. On January the 16th, 127 persons recovered. So this slide shows the number of cases recovering on a daily basis, and we are happy to underscore that as a federation we are enjoying an excellent recovery rate with respect to this fourth wave of COVID-19 cases. So during this period, December the 24th to January 18th, we added 2,243 cases to our COVID-19 tally. You see the data disaggregated by island. We added 287 for the island of Nevis, 1,956 for the island of St. Kitts. Now, when you look at the gender breakdown for these 2,243 cases, 53% were female, the remainder male. And to date, we have not added any deaths. We have not had any COVID-19 related deaths over or during this wave. Now, in terms of the cases that have recovered in this period, 1,151 cases have recovered in this wave or during this period. And when we look at the vaccination status of the recoveries, 73% of the recovered cases fully vaccinated, 27% of the recovered cases unvaccinated. And we are monitoring the average time period to recovery. In other words, the average time period between diagnosis with COVID and recovery. And it's around 7 to 8 days. Now, we also looked closely at the number of persons diagnosed during this fourth wave. We looked at their vaccination status, and 79% of those impacted or infected with COVID during this wave have been fully vaccinated and 21% unvaccinated. But let's look at the age range. Majority of the cases fall within the age group 20 to 40 years. So most of the cases diagnosed with COVID between December and present, they fall within the age band 20 to 40 years. So that's the working age group. That's our young adults. These are the ones who participate in sporting activities, but predominantly they fall within the working age group. And so we have to be mindful of adhering to the COVID-19 prevention measures in the workplace setting. This just gives us an idea as to what's happening closer home in the OECS and the wider Caribbean or CARICOM community. So at present, there are some other islands who are also experiencing an outbreak. There is Anguilla with a high or a significant number of newly reported cases within the last 7 days. So Anguilla, Grenada, St. Lucia seems to be experiencing a similar picture as we are. Now, in terms of the vaccination coverage amongst our neighboring islands, St. Kitts and Nevis stands third in line as compared to Anguilla, Antigua, and Barbuda. These two islands have an extremely good COVID-19 vaccination coverage rate. And so St. Kitts and Nevis is in the top 3 in terms of islands who have achieved excellent COVID-19 vaccination coverage rates. Okay, so I'm hearing anecdotally a lot of persons in our community saying that they are experiencing flu-like symptoms. And so, oh, it's just the simple flu. So what are these symptoms? What are they voicing? So a number of persons currently are experiencing COVID-like or flu-like symptoms. And these symptoms include feelings of fatigue or malaise or weakness. Some are experiencing chills, feeling extremely cold when everyone else around seems to be normal. Some complain of a fever, lower back pains, general joint pains, muscle aches. Some complain of sore throat, stuffiness, runny nose, sneezing, coughing, and pain behind the eyes. Ladies and gentlemen, the only flu that's going around right now in the Federation is COVID. Right? So if you are experiencing these flu-like or COVID-like symptoms, you are probably or more than likely experiencing or you are affected by COVID-19. So if you are experiencing these symptoms, we want you to self-isolate. What does this mean? We want you to remain at home. Do not go to work to expose your work colleagues to the virus. We want you not to go to church. We want you to opt not to attend a funeral while experiencing these COVID-like symptoms. We want you to opt not to attend any social groups or gathering while experiencing these COVID-like symptoms. So we want you to self-isolate, remain at home. Persons are recovering nicely and easily with respect to COVID at this time. Most persons have been recovering within a few days, 7 to 10 days. However, if you are not recovering as expected, you can go to the nearest hospital to seek medical care. Now, as we prepare for the full reopening of our schools, we want to underscore the importance of our school children, teachers, auxiliary workers in the school setting. We want to underscore the importance of your adhering to the COVID-19 control measures, because this will be critical to ensure safety in our schools. We also want to encourage parents of the teenagers, 12 to 17-year-olds, to reconsider providing consent for your child to be vaccinated, because this will also ensure safety in our high schools. The wearing of the face mask is going to be very, very important when the other students return to the school setting shortly. And so we want you to wear we want all the children, all the teachers, all the auxiliary workers to be wearing a face mask when school resumes. So if you do have a cloth mask, we encourage you to probably double the cloth mask. And if you have access to the surgical mask, please note that would provide you even better coverage as opposed to the cloth mask. And the students will be required to sanitize hands continuously throughout the school day. So these are the measures that we would want students in the school setting and all persons in the school setting to note as we prepare for school reopening. And again, if a child is experiencing any of the COVID-like symptoms that I just mentioned, please have that child remain at home and not attend school. I must reiterate the COVID-19 prevention and protective measures, and these include accepting the vaccine if you are not yet on board with that. Wearing of the face mask is critical as we work our way through and try to contain this fourth wave of COVID-19 infections. Maintenance of adequate hand hygiene is important, and maintaining adequate physical distance from others when in public spaces. And if you are ill, if you're experiencing any COVID-like symptoms, we want you to remain at home. So these are the non-pharmaceutical measures that are helping us to contain this fourth wave successfully. Thank you.
Thank you very much, Dr. Laws, our Chief Medical Officer. Did I hear you say that the booster is now being offered 5 months after the second dose? Okay. So instead of 6 months, you've reduced it? Okay. I want to acknowledge the Chair of the National Disaster Mitigation Council, the Honorable Vincent Byron, our Attorney General, and also the co-chair of that council, the Honorable Wendy Phipps. I now invite Superintendent Cromwell Henry to present us with the regulations report.
Thank you very much, Mr. Williams, and pleasant good afternoon to all. I'm certain that by now everyone is quite familiar with the regulations and all that it requires us to do. And so I just want to thank you now for adhering to the regulations. We have seen that over the last couple of days, we continue to see a decline in the number of new infections, and I hope that it is not too early to celebrate, but we can't help but noticing that our numbers are getting down. We have to also generally notice the good cooperation from you, the public, with respect to the hosting of social activities and mass gatherings. We notice that you have cooperated well and have not applied for or host these activities without permission. And this cooperation have helped us significantly, I'm certain, in reducing the number of new infections that we are seeing in the Federation. We do not want you to become complacent, however, as you would have already heard from the doctor a while ago, that we are not completely out of the woods. We ask that you continue on the current path of good cooperation. We know that the recommended non-pharmaceutical measures which have been tried and tested continue to work and have shown to be effective in preventing these new infections. We therefore ask that you continue to cooperate and adhere to all the COVID-19 protocols, avoiding crowds and crowded places, wearing your face masks when in public, practice good hygiene and other sanitization behavior, maintain a physical distance of at least 6 feet from others when you are out in public, and if at all possible, please go and get vaccinated. Thank you.
Thank you, Superintendent. I now invite Mr. Abdias Samuel, the chair of our National COVID-19 Task Force, to give us his presentation.
Thank you, Mr. Williams. It's a pleasure seeing you after such a long time. Pleasant good evening to all. And thank you for joining us once more to this NEOC briefing. I want to follow up on what Superintendent Henry just said. I want to commend all those business places and those within the social environment who have been compliant and have been showing consideration to the environment that we are currently facing. To you, I say kudos. And I want to encourage those who are not being compliant or who are being challenged with the policies, regulations, and protocols to please support the efforts of the officers who are doing their best to help in the fight against COVID-19. The fight is multidimensional. It's not just the pharmaceutical or non-pharmaceutical measures. It calls for enforcement. So in this regard, we need your cooperation in supporting those who are doing the best to enforce the protocols and regulations regarding COVID-19. Ladies and gentlemen, there is also a critical challenge that we are being faced globally with, and that's the disruption to the global supply chain. And what do I mean by that? St. Kitts and Nevis imports most of what we consume and what we use. And the reality is, due to the outbreaks in many countries, along with many other factors, the supply chain, meaning that the shipments to St. Kitts, whether by air or by sea, are somewhat disrupted or delayed, which means that some of the supplies that you find on the shelves, you may not be seeing them at this moment. Equally so, you will find that some of these high demand for transportation of goods will cause the cost of goods to go up. So therefore, you may see some different prices as per what you are accustomed to see. In this regard, I am encouraging everyone to do their best and manage your resources as best as possible. This disruption to the global supply chain could be for a short term or a long term, we don't know, but most experts think that this is going to be for a long term. So therefore, please do your best to manage your resources as much as possible. So what are some of the things that you can do? What are some of the things that are being experienced within this particular global supply chain issues and response? We got to look at food security and the supply of goods. We have to look at the disruption that is happening in the workforce, and that was one of my major concerns when we were heading into the fourth wave. What's going to happen to the workforce? That was my major concern. And I think some recommendations were made. While on vacation, I would have listened to a presentation that was made by the Honorable Wendy Phipps, co-chair of the Mitigation Council, where she outlined the recommendations from the Cabinet or the approval of the cabinet for persons to be able to work remotely. However, I'm encouraging persons not to abuse this, as we need to remain competitive. We need to ensure that our economy continues to fortify and remain resilient and continues to do its best to reach where we need to reach. Again, we need to also encourage, the importation of goods, as I said, are delayed. The self-resilience and innovative, we are encouraging persons. What we are seeing is that the spirit of entrepreneurship is rising, and persons, however, will be impacted by this global supply chain issue. What we're also encouraging is the diversification of business. For example, we need to become more resilient plant. We need to get our agricultural sector more active. It's rather active, but we have to get it more active so that we can help ourselves in the event that we face any issues. Now, we are hearing a lot about persons talking about returning to normalcy. Ladies and gentlemen, there is no return to normalcy. And what do I mean by that? We have to look at a post-COVID recovery strategy and era. Now, just like 9/11, we had the impact to the air travels. And we saw basically that post 9/11, the whole culture about traveling changed. The reality is that's what's going to happen with COVID. So don't expect that you used to pay $3 for sardine, and post-COVID, when everything goes back to normal, that you're going to pay the same. That's why I'm saying that you have to manage your resources properly, because things are not going to go back to normal. We have to adapt to the new norm. There's going to have to be a cultural change moving on, going forward, post this COVID era. So what will be required? One of some of the things that we are looking at for the post-COVID era in the short term is the remote working, digital transformation of services. We're going to look at some risk management strategies for the future. We're going to encourage, as one of the resilient pillars going forward, and that is economic diversification, as well as compliance and readiness to respond to any future eventuality as it regards to epidemics, pandemics, etc. We are experiencing some challenges with persons wanting to enter into the Federation of St. Kitts and Nevis. So what do you do if your flight is cancelled or changed? So you go through the portal, you have received approval to enter the Federation of St. Kitts and Nevis. And in receiving this approval, you get that approval letter. Your flight is cancelled or changed. What do you do? So if that happens, all we are simply asking you to do is two things. One, you can contact our help desk at 1-869-765-4880 or 1-869-765-4095. You can also send an email to the COVID-19 Task Force at gov.kn, or you can also look on the website for the other emails for the IT health techs and send the information to them, letting them know that your flight has been cancelled. So what will happen then after your flight has been cancelled? Your application will be reset, so you can go back into your application, edit your application, and formulate it with the updated information. Again, let me repeat. Once you send the information to the team, and I gave you the contact information as well as the email addresses, then your application will be reset. That will give you the capability and ability to go into that same application again, edit the application, update it with the current information, and then you will be approved to be able to enter the Federation of St. Kitts and Nevis. Ladies and gentlemen, based on my experience, I think our system has been working well. In our task force meeting yesterday, we discussed some of the challenges, experiencing it myself, We look at where we can enhance the system, make it more user-friendly, as well as looking at how we can help persons when they are faced with many challenges. And one of the areas that we are going to do is to increase the capability of the help desk so that they can be contacted more easily, and also the communication between the applicants and the persons or agencies that are processing the application. So if you follow these steps, you will have no problem. In addition to that, if you go on the application form, that's the KNA travel form.kn, you will also see some instructions that will guide you what to do if your flight has been changed or canceled. And also, you will be able to contact us if necessary. However, what we are seeing is that we are not getting the cooperation of some of the airlines as we need to get. We have had meetings with the airlines, we have reached out to them. However, we are still having challenges. And what are the challenges? When someone is leaving here for some of the North American destinations, persons cannot enter these destinations without approval. Let me repeat, they cannot board an aircraft to enter these destinations without approvals. However, what we are seeing is that persons are entering the Federation of St. Kitts and Nevis, non-nationals at that, without the appropriate approvals or documentation in terms of the tests and vaccine cards, etc., and then landing here and then having to be processed here. All we are asking for is cooperation. And if this trend continues, non-nationals who arrive into the Federation of St. Kitts and Nevis without the appropriate approval will be repatriated to their the point of origin. So please, we're asking everyone to cooperate with the entry protocols into St. Kitts and Nevis. It's law, it's in the SRNOs, and we seek your assistance in this regard. Yesterday, the COVID-19 task force would have met with the St. Kitts and Nevis Athletic Association, and we discussed the resumption of athletic meets here in St. Kitts and Nevis. And we will be receiving a proposal from the St. Kitts and Nevis Athletic Association in terms of some of the guidance we have given them, so that we can have this document and then further process it to the appropriate authorities, in this regard being taking it to cabinet, getting the cabinet's blessing, and then reporting back to the St. Kitts and Nevis Athletic Association for these meets to commence as soon as possible. We have given them our fullest commitment that we want these meets to begin in a safe manner. However, we must be cognizant of what we are facing right now with this fourth wave. Equally so, we have also received a submission from the St. James, I think it is, Race Association, or, I think that's what they call it, a Nevis. And we are also, that is also under review, as they too want to resume some activities with the racetrack in the St. James area and Nevis. So we will be communicating our deliberation to them once this has gone through the process established. So again, everyone, it's a pleasure to be back. It's a pleasure to start to serve you once more. And we are hoping that with the light at the end of the tunnel, we can now transition to this post-COVID era, and we can continue to restore St. Kitts into this new norm and make us more resilient and fortified going forward. Thank you very much. Thank you, Mr. Williams.
Thank you very much, Mr. Samuel. That brings us to our question and answer segment. How common is false negative results from the PCR test? I have a friend and her daughter who were sick for 2 weeks and I took them to the free testing at the hospital, and they came back negative. They isolated anyway, but if there is no flu going around, then could they have had COVID?
The PCR test is highly sensitive, which means that if you have the coronavirus multiplying in your nostrils and the sample is taken, it will pick it up even if you have a very low viral threshold. It is also highly specific, which means that once you're told you have COVID-19, you do have COVID-19 based on a positive test. However, I've said before that a positive test is as good as the time when it was taken. And so you could come now, have a test, and test negative, and you're truly negative. And you can leave this room and go outside and pick up the virus and come down with symptoms sometime later on. And so just because you tested negative doesn't necessarily mean that you have to drop your guard. Also, yes, in this wave where we know that the predominant virus responsible for the flu-like symptoms would be the coronavirus, someone can still have the flu, and so you could have flu-like symptoms, you have a PCR test, it is negative, and it could be that you had a flu-like illness, but the precautions are basically the same.
I don't know if you want to clear this up, Dr. Wilkinson, but there are some people who are saying, and I have heard it many times, that the CDC has said that the PCR test cannot detect between the common flu and the COVID.
The flu is caused by an influenza-type virus, and one can do testing for that. The COVID-19 is caused by the coronavirus, and we use the PCR test for that. So those are two completely different tests. And so if you test positive with the PCR test, which is done specifically for the coronavirus, you do have coronavirus. It's not going to tell you that you're positive for coronavirus and it was supposed to be the flu.
Thank you, Doctor. When will the AstraZeneca be made available again? I have taken the first dose. I went for the second dose, but they said it's not available as yet.
A very good question. At present, the Ministry of Health is trying to get our hands on the next batch of AstraZeneca Oxford vaccines. But in the meantime, you can mix and match. So in other words, if you have received the first dose of the AstraZeneca Oxford vaccine and you are willing to get your second dose of a COVID-19 vaccine, feel free to go back to the health center and you can get the Pfizer-BioNTech vaccine as your second dose. And so mixing and matching is allowed and approved in the Federation.
Thank you, Dr. Laws. The Pfizer vaccines that came last August, have they expired? And if so, if not, when will they expire? This one also, if expired, when will we get a new batch? And which brand of vaccine expires on the 28th of February?
I think it's important for me to, from the onset, state a policy of the Ministry of Health and the government of St. Kitts and Nevis, in that we said very early that we will not be using any expired vaccines on the people of the Federation of St. Kitts and Nevis. And so any vaccines that expire, they are discarded. With that said, there is really no reason for us to continue to have these expiry vaccine trackers that we seem to be getting asked all the time. The same way, for example, you go to a pharmacy and you expect to get a drug that's not expired, and you don't come here asking us those questions. We are not going to give you any expired vaccines. With that said, the batch of Pfizer vaccines that we have, they are due to expire on the 28th of February, and we will be sourcing more before the expiry date.
I don't know of any responsible medical institution or professional that give people expired vaccines. So I'm kind of curious to know why this question keeps recurring. It seems to me with all the attention being on COVID-19 at this time, how is this impacting the Ministry of Health's focus on other ailments and treatment, such as diabetes, cancer, and other NCDs?
The Ministry of Health continues to provide general health services to the population of St. Kitts and Nevis. And so with reference to our non-communicable disease program, that is up and running and functional. And so at each and every health center, the regular clinics, whereby the district medical officers and the public health nurses, they offer the regular services to our diabetics or patients with hypertension, heart disease, and other chronic illnesses. And so these clinics continue. And so that's the very reason why in St. Kitts we offer the COVID-19 vaccines in the afternoon. So the emphasis is to continue the regular clinics in the morning hours, and then in the afternoon session, that's when the public health nurses shift focus to administer the COVID-19 vaccine. And so it's an all-of-society approach, and the Ministry of Health continues its work in terms of providing the regular health services. So regular health services in our health centers, and in terms of our hospitals, we continue providing our in-hospital treatment in the emergency room, the outpatient clinics, and on the general wards. Thank you.
Thank you very much. This one might be for Superintendent Henry. My mother is 88 years old and is born here, but would like to come home. But we are told that she has to pay $20 per hour to quarantine at home. Why would the government want to charge an ageable person to stay in her own place?
Let me answer the question this way. The regulation sets out what should happen to vaccinated persons and non-vaccinated persons who are entering the country. There's one process for nationals, and there's one for non-nationals. If you are vaccinated national entering the country, there's no need for quarantine. However, if you are not vaccinated and you are entering the country, you are required to quarantine for 9 days. And that 9 days could be at a approved COVID-19 certified hotel, or you could choose to quarantine at home, in which case you will be required to pay for security, commissioner-approved security, for the duration of your quarantine period. There is no distinction for the age of the individual. All non-vaccinated nationals are required to quarantine for 9 days, and you have the option to quarantine at home or at a COVID-certified hotel. If you choose to quarantine at home, then the regulations require that you pay for private security.
Thank you, Superintendent. This is our last question for today. Why don't we have a general policy for the restart of all national sports?
So Williams, I think that's a very, very good question, and we have already we have had this discussion already. However, there are some sports that are at a higher risk than others. So there is no one-size-fits-all cap here. Some sports will require some different protocols, while some other sports that are less riskier will require. So the risk associated with the sport will require different protocols. So there is no one-size-fits-all policy for sports. I think what we want to, the one-size-fits-all policy, not to offend anyone, is that we want all the sporting communities to reach a threshold of approximately 70% vaccination rate for them to be able to operate under this environment at this time. And we want to commend those sporting communities who have been doing a marvelous job in ensuring that they safeguard and protect the players, the staff associated with the teams, as well as the officials. So that is why we can't just have one blanket approach to everything. There are different types of risks associated with the various sports. Football compared to something else like golf, right? Where golf is a sport that you might be just by yourself. You don't require that level of contact and interaction like a football or basketball. So that is the reason. So again, the only one-size-fits-all cap for all sports is to ensure that we get a 70% threshold for fully vaccinated players and staff associated with the sport, so that we can have a level of protection. It's resiliency, because if one person comes down with the virus, then that means that the entire team does not have to go down. So that is why we are trying our best to build resilience among the sporting community. I don't know if any other of my colleagues want to add anything else.
And even Novak Djokovic could not play in the Australian Open because he was not vaccinated. But tennis is not a contact sport. That brings us to the end of our question and answer segment. I want to thank all of our presenters, the Superintendent Henry, CMO Dr. Hazel Laws, and our Medical Chief of Staff at JNF, Dr. Cameron Wilkinson. We thank Mr. Abdia Samuel, and welcome back, Mr. Samuel, the chair of our National COVID-19 Task Force. You know, our task force has been going now since the start here of the pandemic in the Federation. And it takes up a lot of time, because sometimes we meet every week. At one point, it was every day. Now it is once a week, and sometimes more than once a week as the need might arise. And we meet for hours just discussing what is happening, how to manage the pandemic, and so on. And it is all done really because we have an interest in wanting the best for St. Kitts and Nevis, the health of the population, and whatever else is attached to that. We want the best for the Federation. And so hours are spent, sometimes 5-6 hours, just in a meeting and discussing how to go about this and how to go about that. So it's important that people know that. We thank all the workers at NEMA. We thank Michelle Rodriguez. We thank all of those persons who work in terms of with the online immigration and customs form, the data entry clerks, and so on. There are a lot of people who are working behind the scenes in terms of the management of the COVID-19 pandemic. We thank Mrs. Christmas Jacobs for her service, and we thank all the media houses in the Federation who play a key role in the dissemination of information, publication, and all of that. They are key in the management of the COVID-19 pandemic. We say a special thanks to ZIZ, who carries these briefings live, both on radio and television, and also social media. And we can't forget Dr. Marissa Carty, who works very, very hard behind the scenes, doing a lot of the stats and all of that we receive each day. Thank you to all of you, to our chair and co-chair of the National Disaster Mitigation Council, who equally continue to work very hard at the cabinet level, working with the COVID-19 task force in managing the pandemic. Thank you very much. Next week we will be back with another NEOC COVID-19 briefing. Until then, take good care. I am Les Roy Williams.